Okay, so hip flexion bias. Okay, so I don't want to lift the leg. Bend your knee, please. Thank you so much. Now, again, if I want to be mildly dismissive of common discussions in the profession, I can say that that's active first. It's disingenuous, but I could do it if somebody really wanted to bother me. So pardon?
Short-term active.
Yeah, sure. Yeah, short-term active. I like the term. Thank you. You are creative. So palpating through under the circumstances, you're going to assume that the front gets a little bit softer, but in this case, no, because the front of the hip is softening, it's shortening. So you assume it's going to get softer, but it doesn't. You agree? Right? So now, a little bit more flexion, but deflection out of the sagittal plane. So if I come over here, tight. If I come over here, softens, and then I drive. So it's kind of like I'm pushing the femur into the pelvis. It helps soften it, right? Now, position-wise, this can be hard on me because of where I am, and I have a relatively straight arm. I could do this to get the same thing. This is easier on me, more contact, more control, less effort. I'm closer to what I'm working on, right? I can lift the foot off the table when I'm seated, but I don't want to, right? You can get into flexion when you're standing. You can do it by shouldering it, okay? The problem is it's going to be heavily biased to a lot of flexion, so maybe too much flexion. The other deal is your ability to control is limited by your position and your stance. You're going to have a slightly wider stance, and you have to be leaned. You have to be. You can walk up the table to get closer. You can walk down the table. When I say walk, I mean move one foot, move the other foot, move the back foot, move the front foot, move the front foot, move the back foot. That's literally what I mean. You walk 1 foot at a time. This, I have to be leaned. Okay, I get good compression out of this. I do not get good traction unless I do this. Because now I have contact on both sides. So I can compress to some degree and I can traction to some degree. Or I can come in here and do most of this with my body. Okay? There. Okay? Right? So I'm going to try to soften that. Interestingly, see, that makes it firmer. And that makes it softer. It is different. It's a different spot, but it's different than when the foot was on the table. Yeah. Okay, so now I'm coming more to midline to soften it. Now I'm going to actually assume that softens it a little bit more. And I went into a bit more flexion, like proper sagittal plane flexion. And I'm going to try a little bit of internal rotation, a little bit of external rotation. The external rotation helps. Okay, now the compression is hard because I see how I'm rolling over her leg. I'm not really getting any compression, but I'm sliding over her. There's a little bit of compression, but it's not good. It's the hold. I can't get a lot of it. Might be able to get a little bit of traction, and that helps a bit. Yep, so it's a little bit of traction. Because you see how I'm under the leg, I can stand up and get some traction. All right, so it's just all the little moves.
What structure is your left hand actually palpating? Or is it a few? Because it's hard.
Yeah, so it's on the opposite side of the table, so I apologize. Same thing for the camera. It is the anterior soft tissues, slightly inferior to ASIS. Right? There you go. So the holds are the same holds you can use for other things. Depending on how you're holding something, you're going to get more availability of certain movements, less availability of other movements. Some of you did a really good job. I think I definitely saw Mike do it. I think I saw some other people do it. Hip flexion bias. Okay, Captain Morgan, right? Now I can kind of get into the same thing. So I'm going into the same area, ASIS, slightly inferior, just checking for whatever's firm, right? Interestingly, we found another thing, more on the quad, but because it's high quad, I can probably get this done. Okay, so I'm going to go into a little bit more flexion. It softens it up, but maybe not the right way. Right now, you'll see the external rotation and the internal rotation. The internal rotation makes it a little tighter. The external rotation softens it.
A little bit,
yeah. So I come a little further out, a little further up. Now it's nice and soft. I compress to see if it softens. And then I have to do this now. Traction doesn't soften it up.
No, compression, I think, does
A little bit.
something.
A little bit. Yep. Okay. But because my knee's there and I snuck my hand underneath the knee, if I'm in a better position like this, I can compress better. Because my hand's under, I can traction by standing up. So I just lean down or I stand up, right? It's not going to be perfect traction or perfect compression because when I do it, it'll deflect a little bit. So if you watch the leg will move, right, in relation to a midline. So it's not a proper compression or a proper traction, but it's close enough, right? So you can get all the same stuff to happen. You can make her go active after that. Sometimes it'll work, sometimes it won't. But not predictable what contraction will make it soften. You can assume that it's going to be something like, if I want the hip flexor to soften, I need to get her to contract the hip extensor. So I would need to have her squeeze her glutes. But when you tell people to squeeze their glutes or squeeze any muscle and you have them in a non-neutral position, usually everything around the joint contracts, at least experientially, but not always. All right, so you have to check it all. Sweet.